Not scared but excited is the sense that we're getting from all those kids who are getting vaccinated, those teenagers from the 15 to 18 age bracket. But understanding the significance of this phase of the vaccination drive, on that note, I'm joined by Dr. Manish Manan, HOD Pediatrics and Neonatology at Paras Hospitals. Dr. Manan, thank you for joining us on the broadcast on CNN News 18. Now, we are seeing that there's a lot of energy on the ground, as I was pointing out. A lot of kids are very excited to get that dose. Even this sense coming in from the children that, you know, it's our duty to get vaccinated and to join the entire fight against the COVID virus. Now, decode the importance of this phase of the vaccination drive for India's overall vaccination strategy, because as compared to the West, we have very high vaccination rates. That's something India can be very proud of. And at the same time, as we can see among those kids, there's an almost eradication of vaccine hesitancy.
Very nice to see that. It was very heartening to see the excitement amongst the kids. And, you know, one of them just said that, you know, it's our national duty to get it done. So vaccination for in the pediatric age group has been long awaited, and there have been a lot of requests for this from the parents, from the schools, from the children. If we understand the COVID effects on children, you know, less than 12 years, there was probably no mortality in this country. About 75% of the morbidity and mortality, whatever was seen in the first and the second wave of COVID, was seen between 15 to 18 years of age. Hence, this was the age group which, you know, should get the vaccine shots earlier. And as they keep getting the vaccines, you know, the numbers will increase gradually. We'll have more confidence on the effects of the vaccine, on the adverse effects, on the efficacy. And as we gradually go down from 15 to 12 and then below that, you know, we'll be more confident of the vaccine, and even the parents, the society will be more confident. I'm very happy to see that there is no vaccine hesitancy. It is important. Also, it is important to tell the children, you know, somebody was saying, you know, after this, we are free to go. You know, if somebody is vaccinated, the chance of getting a severe disease is less, the chance of hospitalization is less. However, it is not necessary that somebody who's vaccinated will not transmit the virus to another person. He can still transmit, but that individual himself may not suffer the severe disease. So this is something they have to understand. Also, the vaccine will become effective after 4 weeks of the second dose. So, you know, these 2-3 things children should also understand who are taking the vaccine.
Right. And doctor, also what we are getting these concerns from many of the parents. Now, the parents who have been vaccinated, they felt those side effects, you know, body pain, some cases, some fever, light fever, and pain at the injection site. And, you know, they're concerned about how that will impact their children in the 15 to 18 age bracket. So any concerns coming in on that front when it comes to how children can deal with those vaccine side effects?
So I'll just enumerate from what happened in the Covaxin trial. About 525 kids were enrolled in the study. About 374 had encountered minor side effects like, you know, pain at the site of the vaccination and mild fever and body ache and all, which they can encounter after any vaccination. When we give a normal tetanus vaccine or any other routine vaccine, that can also cause fever and pain. When we give DPT shots to small children, they can also have swelling at the site of vaccination and pain and fever. So they encounter that. So that has been seen till now. Now, as the number increases, then it needs to be seen, you know, how many more children get these minor side effects, or if at all there are any serious adverse effects, that needs to be seen. But seeing the adult population, they have tolerated it very well, and 15 to 18 years are teenagers, so we hope they'll be able to tolerate it well. And minor side effects is acceptable anyways, keeping in view the fact that it's going to prevent them from a serious illness and hospitalization in the eventuality of getting a COVID infection.
Right, Dr. Manan, that view coming in, that message coming in from Dr. Manan, that when it comes to the entire inoculation drive, parents should not be worried. Get your kids vaccinated. They can deal with these side effects. Before I let you go, Dr. Manan, we're getting all those reports. Okay, we've lost that line with him.